But years of chronic symptoms and disinterested doctors almost forced Joanne Citrone to give up on ever finding a cure. Joanne Citrone was the baby of her family, an upbeat and healthy kid brought up in a tight-knit Italian family in New Jersey.
As a child, I loved to play sports. I was very athletic, enjoyed playing basketball.
She was a beautiful child, lots of fun.
And just like many young women, Joanne first starts her period at age 13. But 2 years later, something strange happens.
At the age of 15, my menstrual cycle stopped. It was kind of devastating. Everything was going so normal. Why did this stop?
At first, I thought, well, this is just temporary. But after quite a lapse of her not getting her period, I knew something wasn't right. And I made the first appointment to our gynecologist.
The gynecologist runs a battery of tests and performs a full exam.
The pap smear was normal, but the blood test did reveal a high level of testosterone in my bloodstream.
Testosterone is a hormone that is responsible for the development of masculine characteristics. Mostly produced in the testes in males, smaller amounts are produced in a woman's ovaries.
The doctors said, you really should take her to an endocrinologist, and that's what I did.
He went over the blood work that the first doctor performed on me and stated that they were going to run some more tests.
The endocrinologist felt that putting her on a mild birth control pill would stabilize her period and bring it back to when normal.
Joanne goes on the birth control pill, and after 2 months, her period returns. Her blood still shows high testosterone levels, but her doctor doesn't seem worried.
He really didn't make much of it.
We just discussed it that yes, it is still high, but continue on the birth control pill, and this was something that I had to accept.
After a few more months, Joanne's period is coming regularly. But soon, she sees another change.
In 1 year, I went up at least 50 pounds. I just looked swollen, and I hated looking like that.
Joanne is told the weight gain is a side effect of the pill. And though she exercises daily and watches her diet, nothing changes.
I myself couldn't understand it. She went to Weight Watchers for many years, and she still wasn't losing any real weight.
I joined the gym. I was doing aerobics. And it was just such a slow-moving weight loss.
Then another embarrassing symptom begins to develop.
Body odor. I was told the body odor was from being a teenager, being more active. I didn't feel myself or see myself sweating anymore. I would try every deodorant possible and just didn't seem to help.
And when Joanne turns 17, another bizarre symptom appears. Brown spots on the back of her neck, elbows, and knees.
It actually looked like my elbows were just filled with dirt. And that was very embarrassing because people would comment, "Oh, do you have dirt on your elbows?" I said, "No, this was my color." And they was like, "Oh."
I first noticed a couple of brown spots. I couldn't figure it out.
My mother told me to use lemons, rub lemons on my elbows to just decrease the color.
I thought that lemon, being acid, would lighten the color of her elbows.
And that's what I did, and it didn't work.
Joanne checks in with her endocrinologist every 3 months for blood tests, and she tells him about the disturbing changes her body is going through.
And when I would ask him about the other symptoms, he would try to just figure out ways to help me persevere with them.
This is really the most difficult thing for me as a mother. You go to a doctor, they're telling you, oh, everything is, it's just a little high, but there was no treatment to be done for her.
Joanne accepts her doctor's findings and goes through college just managing her symptoms day to day. At age 22, she meets Scott Citrone, and they begin a 3-year romance.
Scott and I were forming a really nice bond together as a couple, and there really wasn't any reason to worry about any type of symptoms I was having.
She never made a big deal about her doctor's visits. She did tell me about the high testosterone level, but the other symptoms were not real visible to me at the first. She looked and seemed normal, healthy. I wasn't concerned about it at all.
In June of 1996, Joanne and Scott marry. A few months later, Joanne stops taking the pill for the first time in 10 years.
I was told a high level of testosterone might affect me when it's time to have a baby, but it's not a big deal because, you're on a good track receiving menstrual cycles. When I'm told nothing's to worry about, I just move on and don't worry about it.
1 month goes by with no period and no pregnancy. Joanne isn't expecting immediate results, so she and Scott remain patient. But then, one day, she notices something disturbing.
Whiskers started popping out. I did not feel like I was an attractive wife. And when I talked to the doctor about that, he says it's very common for when you reach a different period of time in your life. But I was only 26 at that time.
A girl puts makeup on and you hope that your lipstick is on right. Imagine worrying, I wonder if I have a new hair that just appeared.
Anytime I would see a stray hair, I would pluck it.
Every night, it was just something she had to do before she went to bed.
Months go by with no periods and several negative pregnancy tests. Joanne's doctor tells her to check her temperature daily to track her ovulation. He also prescribes Clomid, a fertility drug used to induce ovulation, but nothing works.
I think she was starting to feel helpless. Why is this happening to me? It was heartbreaking to hear your daughter with such a plea.
26-year-old Joanne Citrone has been suffering for over 10 years with bizarre and embarrassing symptoms: weight gain, body odor, discolored skin, facial hair. She has also been unable to conceive a child. Her doctors say these are all results of elevated testosterone levels, but are nothing serious to worry about.
We had confidence with the doctor's diagnosis, and there wasn't any questioning of why I continually had high testosterone every 3 months of my blood work. So you just move on and live life.
Desperate to get pregnant, Joanne continues with her regimen of fertility drugs. But after 3 months and no pregnancy, her doctor delivers some bad news.
He told me he couldn't treat me anymore for my infertility if the Clomid wasn't jump-starting. He reached his limits of what he could do for us as a couple trying to conceive a child. I felt really failed by him. Why? After going to a doctor for 10 years, didn't he fix me?
It just seemed like he did all he could and he was done. And he just pushed us off onto someone else.
But Joanne is determined to have a baby, and of all the symptoms she endures, her infertility is the only one she is not willing to accept. Eventually, she decides to go to a fertility clinic.
During consultation, I gave the doctors the full 10-year background of why I was going to the endocrinologist. And I did mention high testosterone to him. There was never even an emphasis on how we're going to handle that. Their emphasis was to produce a baby for us. Never during that time frame was my high testosterone noted, checked, concerned about. Nothing.
It seemed like it was forgotten about.
Over the next few years, Joanne endures 6 artificial inseminations, none of which result in pregnancy. The next step is in vitro fertilization.
They were able to retrieve 48 eggs. 30-some were fertilized. They implanted them. 10 days later, we were pregnant. And it was a really good feeling at that point.
But their joy over this pregnancy is short-lived.
My girlfriend took me out to one of our favorite restaurants, and I feel these twinges, and I started spotting. And immediately we left. So they had to drive me to my aunt's house right up the street. And I had to call Scott. And as I'm calling on the phone, I feel something just drop. I miscarried at my aunt's house.
Joanne is crushed. She immediately abandons the fertility treatments and seeks out the opinion of a new OB/GYN in Philadelphia.
He looked at all my levels, and he looked at the fact that I did not have a period since 15. He just said that even if I did get pregnant again, it would be a non-viable pregnancy. Give up the fact that you can have a child.
The eggs aren't good. You're not going to have a child. Get over it.
The doctor confirms that Joanne's eggs are compromised because of her high testosterone levels, but he informs her that non-viable eggs are the least of her problems. Her history of irregular periods puts her at risk for a deadly disease that none of her other doctors, all these years, had ever mentioned. Cancer.
That's all I had to hear. That was enough for me to say that we're done. You're going to get back on the pill and you're going to regulate yourself.
The doctor really made me feel that I'm in a very unhealthy state.
The doctor visit is shocking, but a reality check. They decide to pursue adoption, and Scott urges her to see a new doctor in order to get her testosterone levels under control.
Well, I go into the endocrinologist, and he said, Joanne, what other symptoms of polycystic ovarian syndrome have you had? I've never even heard of polycystic ovarian syndrome. What is that?
Polycystic ovary syndrome, or PCOS, is a hormonal disorder in which the ovaries overproduce testosterone. While Joanne has known since the beginning that she suffered from an imbalance in her testosterone levels, she'd never actually been given a diagnosis before. The recommended treatment is to go back on the birth control pill.
So I did walk out of that office with that diagnosis. I accepted it. I didn't care about anything anymore. I was done with doctors.
Joanne Citrone is eager to put over 10 years of infertility and other bizarre symptoms behind her. In 2001, she and Scott adopt a son, and 3 years later, she's ready to give him a sibling. But Scott is still concerned about her testosterone levels and the chance that she might be at risk for cancer.
I finally said that, if there's a chance that you're going to not be around to help me raise this child, no, we're not going to do it.
The only way we were able to start proceedings for our second adoption was that if I saw another doctor. Because in his mind, I was going to get cancer if I did not take care of my high testosterone issues.
Joanne is loath to get back on the medical merry-go-round. But then her mother, Connie, comes across an article in a magazine featuring a doctor who specializes in polycystic ovary syndrome, or PCOS, the hormonal condition Joanne believes she has.
As I read this article, I became very, very excited. I couldn't wait till Joanne returned home. As soon as she got in the door, I said, "You have to call this doctor."
I said, "Mom, I'm done with the doctors. I don't want to do it." A couple days went by and that article sat right on our kitchen table. It was like drawing me.
Joanne soon makes an appointment with Dr. Catherine Sharif, the specialist featured in the article.
Joanne told me that she had been told for years that she had very high testosterone levels, but not where it came from and what to do about it. There is no normal situation where a woman would have a high testosterone level. Normal is probably under 50. Joanne's testosterone was probably the highest I've ever seen in 10 years of practice.
Joanne's testosterone tops the charts at 107. And after reviewing her records, test results, and performing a thorough exam, Dr. Sharif confirms the PCOS diagnosis. But she also tells Joanne something she'd never heard before.
She had high insulin levels. I don't think anyone had ever explained that to her.
Women with PCOS commonly have high levels of the hormone insulin. This can lead to high testosterone, menstrual problems, and weight gain, among other things.
The brown patches on the back of the neck or on your knuckles, knees, or elbows are classic for very high insulin levels, which we call insulin resistance.
And she said, well, it's a good chance that if you start this insulin-resistant medicine, that you'll be able to get a period on your own.
Joanne takes the medication for 3 months and then returns to Dr. Sharif's office for a checkup.
My insulin numbers went down, but my testosterone still remained high.
She couldn't believe it because she was feeling so good. She had lost some weight, and that was just like a kick in the stomach to her.
When I saw that Joanne's testosterone hadn't changed in 3 months, I thought she may not have polycystic ovary syndrome, because if it was coming from her ovaries, the testosterone would have dropped with the treatment. I mean, I have nearly 1,000 patients now, and the testosterone always drops in 3 months. Something didn't match up.
Dr. Sharif is beginning to think that perhaps Joanne does not have PCOS at all, and that her high testosterone is coming from somewhere other than her ovaries. She decides to try something. She prescribes a different drug, a steroid called dexamethasone. If it works, Dr. Sharif will have isolated the source of the testosterone and have a new diagnosis.
After 3 months of taking this tiny dose of steroids, Joanne started to get periods and her testosterone level dropped dramatically. And then I knew exactly what she had. It confirmed the diagnosis of non-classical congenital adrenal hyperplasia.
Non-classical congenital adrenal hyperplasia is caused by an enzyme deficiency in the adrenal glands located on top of the kidneys, which secrete the hormones cortisol, aldosterone, and tiny amounts of testosterone. Normally, this enzyme helps to keep hormone production in balance. In Joanne, the enzyme wasn't functioning, which led her adrenal glands to produce more than double the amount of testosterone that she needed. While not as problematic for men, the excess testosterone in a woman can result in body odor, weight gain, facial hair, and in some cases, infertility.
It's an amazing feeling to finally have an answer to that underlying question we've been wanting to know for years now.
Finally having a diagnosis is a load off both of our minds.
But Joanne still wonders why it took her so long to get the right treatment.
I think the reason that congenital adrenal hyperplasia goes undetected is, number one, it's very rare, and number two, it's really hard to understand the pathways that lead to it.
The critical clue was discovering where the testosterone was coming from and realizing that Joanne did not have the more common PCOS.
Polycystic ovary syndrome can be confused with non-classical congenital adrenal hyperplasia. Both women have high levels of testosterone. One is coming from the ovaries and the other is coming from the adrenal glands. But you can't tell that when you look at someone. There's no bad hormones or good hormones. There's only balances of hormones. If you don't have a balance of hormones in your body, you have all kinds of problems.
If Joanne had not been diagnosed, her chances of developing diabetes, high blood pressure, and endometrial cancer were high. But now that she's on the proper medication, Joanne's progress has been excellent. Her symptoms are a thing of the past, and it might even be possible for her to conceive in the future.
My testosterone reduces every time I go for my blood work.
Everything seems to be getting back to normal, and she's energetic, she's happy, she feels healthy again, and it's amazing the difference in her.
I feel like I have been rejuvenated with my body. My mind is at ease.